Stroke is one of the most dangerous diseases for the elderly, often occurring suddenly and leaving serious consequences. But why are the elderly more susceptible to stroke than other age groups? Can we prevent this risk? In this article, let's explore the causes that make the elderly more prone to stroke and effective preventive measures to protect the health of ourselves and our loved ones. 1. Causes of stroke. When the weather changes abruptly, with a large temperature difference between day and night, and when it gets cold, the factors leading to stroke in the elderly are exacerbated. Stroke is an acute condition that can happen to anyone at any time without any warning signs. The early stage of this disease is often recognized by symptoms such as a drooping face, numbness or weakness in the limbs, even paralysis, a crooked mouth, unsteady walking, dizziness, choking, difficulty swallowing, difficulty speaking, blurred vision, and more. Therefore, during cold weather, elderly individuals with a history of high blood pressure are at high risk of stroke, which could lead to complications or death if not detected and treated in time. In the case of a stroke caused by cerebral ischemia due to aging, blood vessels in the elderly become hardened, resulting in higher vascular resistance, along with metabolic disorders like high blood lipids, diabetes, etc. In cold weather, the self-regulating mechanism of cerebral circulation in the elderly becomes less efficient, leading to the risk of stroke and increased chances of death if not detected and treated promptly. Doctors also mention that the elderly often suffer from multiple underlying health conditions and have weakened immunity, which leads to poor blood vessel regulation in the brain. As a result, when the weather gets colder, especially during the night and early morning, elderly individuals who suddenly sit up are highly prone to stroke. Stroke is not only common in the elderly, but can also occur in younger people. The symptoms in both groups are quite similar, and the severity will depend on the size and location of the brain damage. However, symptoms in the elderly are not as obvious as in younger individuals, making it harder to detect, which often leads to delayed hospital admission and worsened prognosis. According to doctors, stroke is a significant health concern for the community. While in the past, the condition mostly affected women over 50 and men over 55, stroke is now increasingly appearing in younger individuals, with some people in their early 20s at risk of this disease. Any factor could trigger a stroke in a patient, such as metabolic disorders like diabetes, high blood pressure, high blood lipids, obesity, lack of exercise, smoking, unhealthy lifestyles, and stress. These factors are commonly seen in the elderly, while younger patients may also have genetic factors, abnormalities in blood clotting or vascular issues, which increase the risk of blood vessel blockages or ruptures. 2. Prevention of stroke in the elderly. According to doctors' recommendations, elderly individuals and middle-aged people should keep their bodies warm before going to bed, and whenever leaving their rooms or homes, including walking in the morning to avoid sudden temperature changes that could cause blood vessels to rupture. Additionally, the elderly should maintain a regular sleep schedule, wake up at consistent times, exercise daily, drink plenty of water upon waking up in the morning, and have 3 balanced meals a day. Regarding diet, elderly individuals and middle-aged people should include more green vegetables, soybeans, fruits, fish, and less meat in their daily meals. The food should be prepared with a moderate amount of salt and limited fat content. Moreover, elderly individuals should quit smoking and limit alcohol consumption to maintain good health and prevent stroke. 3. What to do when a stroke is detected. If someone is suspected of having a stroke, they should be placed in a position with their head elevated, lying on their side if there is vomiting or altered consciousness. During this time, The patient should not be given any food, drink, or medications, including water. Emergency services should be called immediately. The golden time for a stroke patient due to ischemic stroke to receive medication to reopen blood vessels is approximately 4.5 hours from the onset of symptoms. Patients with a large blood vessel blockage can be treated within 6 hours of the onset. After this period, the risk of severe complications is very high. Doctors advise the public, especially the elderly, to seek medical attention if they notice any unusual health symptoms to ensure proper checkups and treatment, especially during the cold season. Be proactive in paying attention to your body and never overlook even the smallest signs in the elderly. Maintaining a healthy lifestyle, regularly checking your health, and early detection and control of risk factors such as blood pressure, cardiovascular health, and diabetes will help protect you and your loved ones from the risk of stroke. Remember, prevention is always easier and more effective than treatment.